Hi, I'm Jeremiah Maddox. I'm an orthopedic surgeon. I chose orthopedics because I find the musculoskeletal system to be fascinating, especially the spine. The spine is complex and many of the conditions associated with it are also complex. However, many of the complaints we hear from patients are quite similar. While some patients complain of severe back pain, others complain of leg pain, leg numbness, and even weakness. Many complain that they can't walk the distances that they once walked. Also troubling are the patients that complain that they're not able to enjoy the quality of life that they once enjoyed. Many of the activities which they previously enjoyed, they're no longer able to do. One of my goals as a spine surgeon is to help patients get through their back condition and back to enjoying their activities once again. One of the most important things when meeting a patient for the first time is to listen to the patient. The patient's history is among the most important facets of the information that we gather on the initial assessment. I like to ask a patient the level of the pain so I can get a baseline for how badly that patient is hurting and hopefully get an idea of how successful our treatment is in the future. I also like to know how long has the pain been there, was there an injury that brought this about, and what treatments have been tried thus far. Other key components when seeing a patient for the first time include imaging and a close physical exam. When used together, these can be quite helpful in formulating a diagnosis for a patient. Some of the more common diagnoses I see are degenerative disc disease, herniated discs, and a condition of sciatica. There's a lot of confusion surrounding these diagnoses. A herniated disc is a simple outpouching of a disc that can compress a nerve root. I think of the disc much like a shock absorber in the spine. You can see the discs here in between the bony vertebral bodies. If a disc is to lose some of its integrity, some of the contents can be spilt out. If this happens, it can put pressure on a nearby nerve root. This can contribute to significant back pain, leg pain, and even weakness. This can be quite debilitating for a patient. Another common condition I see is degenerative disc disease. This is more commonly seen in more elderly patients, and we commonly see that the disc will have some wear and tear, and the nearby joints may have some bone spurs, and these things together can contribute to crowding of the nerves, which can also contribute to significant back pain, leg pain, and inability to walk long distances. There is a condition called sciatica, which can be seen in any of the two previously mentioned conditions. Sciatica is simply inflammation of the sciatic nerve. The sciatic nerve is made of several nerve roots from the lumbar spine or the lower spine. When this nerve gets inflamed, it can cause pain in the buttocks and even down the leg. This can be quite troubling for many patients. It is important to begin with conservative treatment. Commonly, we'll begin with physical therapy, a rehabilitative program, possibly a back brace, and if needed, anti-inflammatory medications. If these things are unsuccessful, consideration can be given to an injection. We commonly send a patient to a pain management clinic to assist us with these injections. These can be epidural type injections, which are given by way of a steroid injection to help with the inflammation around the nerves. These can be quite helpful in relieving patients' pain. If conservative measures fail and surgery is needed, we try to choose a procedure designed to relieve the pain and dysfunction of a specific back condition. After surgery, patients can recuperate on a floor with orthopedic nurses that are highly trained to care for their needs. A member of our team of orthopedic physicians will check on you regularly during your stay. Your rehab will likely begin the day after surgery to begin with strengthening exercises and walking. Treatment of spine conditions is a challenging but fascinating process. One of my goals as a spine surgeon is to help decrease patients' pain and dysfunction and to get them back to the activities that they enjoy.